Recently, I had a patient, I can't disclose her name. She was having treatment and she shared with me that she went to a very reputable traditional oncology hospital and they basically told her there's nothing they can do for her anymore. And they wanted her to go to hospice. She was still walking, she was still talking, she was still eating. She has an infant, a toddler, and she looked at her husband. She said, how can I go to hospice? I'm not giving up. The oncologist said, well, if you're going to do the natural medicine, everything, you're just wasting your money. And this is her own words that she said to me. A lot of these patients are confused and they're scared. And that's why there has to be other options. And I believe naturopathic medicine can make a positive impact in our society because cancer is not going away.
You have trillions of bacteria and a lot of them are in the gut. 75% of the immune system resides in the gut. So if you're not looking at the gut as the root cause of how to get your patients better, you're actually doing them a disservice.
Naturopathic medicine, check it out. It's been around for well over 100 plus years, helping our society get to the root cause. Welcome to Rethink My Health Radio Show and Podcast, where each week we come to you from our studios in Atlanta, Georgia, talking about healthcare matters that matter most to you, your family, your loved ones, and as I say time and time again, they do matter most to us, the research scientists, the practitioners, the doctors working in the trenches day in, day out, looking for root causes for chronic disease. We've been through a whole series for the past 12 weeks talking about root cause medicine, looking at natural therapies, combating some very difficult topics such as cancer from an integrative oncology perspective, advanced chronic diseases. We've talked about obesity. We've talked about diabetes, inflammation. And today we have a very exciting show because of a special guest I'll be introducing shortly. We're going to be talking about philosophy. When you talk about medicine, medicine has so many components to it. And there's traditional medicine, there's something called osteopathy, chiropractic, Ayurvedic, integrative kind of encompass all of that. But we're going to be talking about an old medicine that's been around for well over a century or so, and it's naturopathy. And we got an expert here in a moment who's a board-certified naturopathic physician. But one of the reasons I want to tackle that, it's because it's been misunderstood. Some traditional doctors do not believe that it's scientifically based, which we're going to discuss that. And we're going to discuss other areas as well. For those first-time listeners and viewers, this is Dr. Gez Agolli. I'm your host at Rethink My Health, sponsored by Progressive Medical. Progressive Medical has been a forward-thinking leader in functional integrative medicine, thinking outside the box. As a matter of fact, I don't think there is a box actually. So we just do and research and find out therapies and treatments and diagnostics because we're focusing on helping our patients get well. This show's about education. This show's not to replace your doctor's advice. We want to empower you. We want you to be galvanized to take action for your health. It's your body, it's your life, and you need to live it well. All right, so let me just jump right in. Dr. Firlande Volcy, board-certified naturopathic physician. Dr. Volcy, first of all, thank you for coming. Yeah, I know that you have a very busy schedule. And I just want to just kick it off and just talk a little bit about you for a minute here. I know you've been practicing as a naturopathic physician for many years. I know that you graduated in Arizona, but you also practice in Alaska. You have a very diverse background when it comes to healthcare. Just take me back a little bit. Take me a little bit back about you. What got you interested in medicine, first of all, and then jumping into naturopathic medicine?
Thank you for having me today. I'm actually really excited. As you mentioned, I am Dr. Firlande Volcy. I've been in naturopathic medicine since 2001. So it's been a while. I always knew that I wanted to be a doctor. So from the age of 11, I knew that I wanted to go into medicine. So I did, the typical things, went to college, and I major in microbiology and chemistry, with a pre-med focus. So it was really pre-med, all the prerequisites to go into medical school. Once I graduated from college, I worked as a chemist, not pharmacist, as a chemist for about 2 years, and I got bored. I was like, this is not my calling. My calling is to be a physician. I took the MCAT, and I had all those different schools email me and send me letters to join to join the school. And one of the odd things that I noticed was I had a brochure from the school that I went to, which is Southwest College of Naturopathic Medicine. So at the time, this is like, mind you, this is like what, 2001. I knew nothing about naturopathic medicine. The only thing I knew was that growing up, my mom would, whenever we get sick, my mom would go outside. She'll pick like some type of herb and she'll brew something for us. And she'd be like,
so your mom inspired you
correct.
Inadvertently without even knowing. Yeah, that's good. That's
Exactly.
good. Moms tend to do that a lot. I know my mom did it as well too. So that's fantastic.
And the other thing too, we did every year we did a cleanse, and we were taking in cod liver oil from the time I was born. So
yeah, cod liver oil, yeah, really tasty, but actually very beneficial. I agree.
Beneficial. So I already knew that that was already instilled in me from the time I was young. So then I did a lot of research. Once I got that brochure, I actually thought it was a scam. I was like, what is this? So I read the brochure, I did a bunch of research, and it called me. It said, this is where I'm supposed to go. So that's when I enrolled in naturopathic medicine 25 years ago.
Yeah, time flies when you're having fun.
Yes.
I totally agree with you. Okay. So that's a fantastic story. Thank you so much for sharing your personal journey. And, I just want to jump right into naturopathy because that could be misunderstood. Now, a lot of doctors may not understand that naturopathy has been around for well over 100 years, and it's been advanced as well. And it's rooted on actually, Benedict Lust is one of the founders of naturopathic medicine. But before the advances on allopathic medicine, which we're not going to talk too much about, but that's just what a lot of American doctors practice, there was something called an eclectic physician. And it wasn't really until something called the Flexner Report back in the 19-teens in that era where this individual discredited certain universities and colleges. But this is something that they taught regularly in medical school. But once again, it's been a well-established profession, and it's a valuable profession. At Progressive Medical, which sponsors this particular show, Rethink My Health, we're big believers in naturopathy. We don't abandon traditional care. We just know that naturopathic medicine has a role because it uses advanced natural techniques to help the body to get back into homeostasis. So, Dr. Volcy, for the listeners that may not be familiar, how would you describe your profession and focused a little bit on some of the patients that you've seen over your career? Just give us some examples. But I really want to get the definition of naturopathy for those first-time listeners that don't even know about it.
Yeah, of course. I mean, for naturopathic medicine, we look at 6 principles. The first is do no harm. And a lot of times when we see our own patients, we want to focus on that aspect. First, do no harm is how we treat the patient that we see and how we navigate through their healing process. The second thing is the healing power of nature, right? So as you mentioned, we don't abandon conventional medicine, but we focus on the healing power of nature. As I mentioned earlier, my mom will go outside and pick a plant and for whatever ailments that we had. So allowing that plant medicine to heal us. The third one is prevention. So before we do anything else, prevention is the best cure. Before you get a diagnosis or prognosis, why don't you focus on preventing, right? Lifestyle changes, decreasing stress, making sure you're not in the moldy environment. Another one is doctor as teacher. So we pride ourselves in teaching the patients how to eat, teaching the patients the things that they do on a daily basis, how they can impact their health. And then, of course, we look at the root cause medicine, right? So what is the root cause? What is causing the problem that you currently have? And the last thing here is identify and treat the cause, right? So you have to identify and treat the cause before you can do anything else.
Yeah, that's fantastic. That is definitely 6 tenets that I actually believe in, as I also studied naturopathy as well, and before I went on to get other advanced degrees. It makes a lot of sense, by the way, what you're talking about, and looking at all those parameters. But I want to point on one point you just made about teacher. So it's interesting because a lot of doctors today are just too busy to teach. And it's really the system. A lot of doctors, traditional doctors, go into profession to help people. They're definitely on track to help people. They just don't have the time.
Right.
And because it takes time to explain. But really, doctor in Latin is docere, and that means to teach. And that's what I love about naturopathic medicine, is that you can take the time to teach that patient to take action. You know, as we go in our society right now, and ChatGPT is making some incredible. We can debate this actually another show. There's positives and there's negatives, of course, because patients are coming in every single day. Well, Chat said this, Chat said that, and listen, I think that the computer can disseminate information rapidly, but it's lacking that critical thinking skills. It's lacking that ability to take that information on how you assess the patient, right? And I think it's great to get information. I think it's great that patients are educated today. I think it's great. But when a patient starts saying, well, Chat said you should treat me this way, well, I don't think Chat can give advice, first of all. I don't think Chat can write a prescription.
Right.
I don't think Chat does testing. I'm not being critical now, but I'm just telling you, I see some potential pitfalls. And that's why I want to focus on teaching. Yeah. Those of you listening out there, we really appreciate you guys listening. This is how you get information. But I'm going to encourage you to find a naturopathic physician, to find a naturopath also. At Progressive Medical, we have several naturopaths here. We're big believers in that. But whether you're listening to us in Georgia or anywhere in the United States, there's multiple states that are licensed, and there's other states that have naturopaths, even though there's not licenses there. Check your credentials, find out that if you like them. But it's about teaching. It's about inspiring that wisdom. And that's what I'm excited about. Thank Dr. Volcy. I really appreciate that. Okay, so let's just jump in a little bit about, we talked a little bit about philosophy. And, you know, there's been some confusion on what naturopathic doctors can do. But I want to focus a little bit on this show and podcast talking about integrative naturopathic oncology, because you just got back from a conference with Dr. Bouquet, who happens to be a medical doctor, and he's very fascinated with naturopathic principles as well. He's a forward-thinking integrative doctor. He's one of our lead physicians at Progressive Medical, and he's a leader, and he's one of the first doctors to talk about gut health. That was like 25 years ago. Now everybody's talking about it. But you just got back from this conference, and doing the research about cancer, it's staggering. Over 2.1 million Americans will be diagnosed this year alone. That is unbelievable, okay? Additionally, turbo cancers are on the rise. Younger Americans are getting cancer. So we have to do a better job. Yeah, there's been some great advancements on immunotherapy. There's a time and place for chemotherapy, radiation also is a little more precision. But now we got to start thinking outside the box. So, Dr. Volcy, I know you've been studying integrative oncology for some time. The American Association of Naturopathic Physicians have an organization that are teaching naturopathic physicians on oncology strategies. Walk us through a little bit about what you learned, and why were you looking to add this to your education?
Absolutely. So we have an organization called ANP, basically focusing on oncology. And funny thing is that was my first time going, and it's the 20th year anniversary since they started the organization. And one of the reasons I was fascinated about oncology period is because of the alarming rate at which a lot of people are getting cancer. And one of the things that I learned specifically that stood out for me was the complexity of cancer. Cancer is a very complex illness, and no one is going to fit into this box. No one is I'm going to give you this remedy and you're going to get better. Right. So the complexity of cancer has to be looked at from both an integrative, conventional term, and a naturopathic philosophy. This is where we bridge the gap between the two to allow what we call the healing power of nature and to help our patients 100% fold. So I don't believe one particular aspect or facet is actually going to help as far as getting the patients better. I think having that integrative approach will definitely make a bigger impact. So overall, oncology is this very complex subject that we all need to lean in to help the patients the best way that we can.
I agree that cancer is complex, and cancer, we've talked about this before on the show. We've talked about this with other experts, and I've been to numerous conferences, spoke to some amazing physicians and research scientists. It's multifactorial. Correct. Right? Mm-hmm. One thing that we're finding out, though, and I have to agree with you, I was really pleased to hear that you went with Dr. Bouquet to this conference, and I'm very excited to learn more of what you guys learned. But getting to this multifactorial and not everybody fitting into that box, mm-hmm. This is what traditional medicine does. Everybody's almost in a box. Everything is a protocol. Diet, for the most part, I'm not going to say every oncologist. And once again, let me just say this up front. We need a good oncologist. We need oncologists because they're fantastic at diagnosing. They're really skilled at determining different phases of the disease process. Unfortunately, a lot of them are not open-minded to integrative aspects because integrative doctors, and maybe they're threatened, some of them, I don't know. And certainly I'm not here to disrespect because we've got a lot of oncology colleagues that are fantastic to work with. Mm-hmm. And I want all of our patients to have an oncologist because we're not oncologists. We're here to support them and to look at different strategies so they become resilient. And lifestyle medicine has already been proven to make a positive impact regardless of the disease process. Any advanced chronic disease, which cancer is, okay? Mm-hmm. Lifestyle makes a huge improvement. We've had a guest on here before, patient on here before, Dr. Pete Sulak, was given a 1% chance to live. And basically, he embraced himself on lifestyle. And he's completely cancer-free now, after he was given a death sentence. Mm-hmm. Recently had a patient, I can't disclose her name, but she was having treatment and she shared with me that she went to a very reputable traditional oncology hospital, and they basically told her there's nothing they can do for her anymore. She was supposed to go on a trial, and they wanted her to go to hospice. She was still walking. She was still talking. She was still eating. She has an infant, a toddler. And she looked at her husband. She said, how can I go to hospice? I'm not giving up. Right. And basically, the oncologist said, well, if you're going to do the natural medicine, everything, you're just wasting your money. And this is her own words that she said to me. She said, well, my insurance and my family has paid over $3 million, which is kind of interesting, okay? Mm-hmm. I don't want to make this about money, but the point I'm trying to make here is that a lot of these patients are confused and they're scared, okay? And that's why there has to be other options. There has to be other ways. And I believe naturopathic medicine, through this accredited organization, can make a positive impact in our society because cancer is not going away, okay? And we want to work with traditional medicine as well because, it saddens me when I hear some patients say the oncologist died, doesn't matter. And it's clearly proven. Dr. Thomas Zefried, PhD, talks about that, has research studies on metabolic strategies to make your body metabolically flexible. And that's one pathway. So let's just jump right in now on the different mechanisms, okay? Because this does involve science. This does involve cell biology. So Metabolic. I totally agree. What are some other pathways that feed cancer cells?
Yes, I mean, that's such a big and important topic. So we think about inflammation. Inflammation is going to feed that cancer. We think about toxins, environmental toxins, being in the moldy environment, having heavy metals. When the body is toxic, it's really difficult for the immune system to work optimally, right? So if we think about us as a whole, we all probably have cancer cells, right? So whether one person develop like a tumor or a malignant tumor, based on what the immune system is doing. So if your immune system is taxed because of lifestyle choices, eating bad foods, right? So what we call, when I was going through naturopathic medicine, we talk it the SAD diet, right? So which is the standard American diet, fried foods, fast foods. Of course, that is going to impact the immune system because you're not giving the body the fuel that it needs to support the immune system. When we think about the stressors, the daily stressors, as far as whether it's a work environment or it's a home environment, if you constantly stress and you're constantly pushing out cortisol, you are suppressing your immune system. The other thing that you want to think about as well is your gut, right? So I think why we shine as naturopathic doctors is because we look at the gut. We look at what is going on in the gut to support us the best way we can.
I'm glad you talked about stress because a lot of people can just say, well, I'm stressed out, just don't do any, do some stress reduction, which is all positive. Here's the problem though. Sometimes you don't realize that the body's under stress. Sometimes you don't realize what cortisol is doing. There's a balance, and that's why if you don't test, you just guess. And what I love about naturopathic physicians and integrative doctors, and sometimes they can be criticized because they say, oh, you just want me to get tested and do the, at the end of the day, if you're not testing, you're just guessing.
Correct.
So I spoke to someone the other day, and they've been a patient at Progressive, and I was asking him how he was doing, and he said, I'm so stressed out. He showed me a copy of his results, and his cortisol was 8 times higher than normal. And it was literally a bell shape, low in the morning, extremely high in the afternoon, extremely high at night. So, did that contribute? Did that cause his cancer? I don't think it causes cancer. I think it exacerbates the healing potential, and that's what we're talking about. And that's why it's so important to really look at the root cause. Hey, I'm Dr. Gez Agolli here, your host at Rethink My Health Radio Show and Podcast. Very exciting show. This show is about education. This show is about empowerment. This show is giving you information to take back to your family and friends. If you or a loved one are battling cancer, I don't care if it's an old diagnosis, a recent diagnosis, seek the help of a natural healer in addition. Put together your team. Have a conversation with the oncologist. Be totally honest at times. If they don't support you, ask them why. Ask good questions. You are not going to make a mistake by changing your diet. You're not going to make a mistake by finding out from an expert on what supplements you actually can take. An oncologist is not trained in diet and nutrition and supplements. It's easy for them to say no to everything, right? Because, they're using some very powerful medications. And after we get back from the break, we're going to talk about some of the supplements that you can take and cannot take, and why are oncologists saying this, don't take anything and you can eat anything you want. We'll talk about that in a minute. But this is all about root cause. And Dr. Volcy is an expert, a naturopathic physician. She's got well over 25 years experience, a wealth of knowledge, and we're going to ask her more questions about naturopathic medicine. So we talked about this gut testing. And when I started doing this 29 years ago in functional medicine, I've been in healthcare for 35 years. From all kinds of roles, starting in management, getting my degrees and doctorate degrees and helping patients and moving back into forward-thinking management ownership. And I've talked to thousands and thousands of doctors. And it wasn't until Dr. Bouquet went to a conference with Jeffrey Bland And he kept on saying, it's all in the gut. Everything's in the gut. It's interesting. This is like 1999, right? No one even knows
Right.
about this. But now we're seeing research after research. Just quickly before we go to break, just tell us why it's important to evaluate gut health.
Oh my goodness. Where do I start? I mean, you have trillions of bacteria, and a lot of them are in the gut, right? You have 75% of the immune system resides in the gut. So if you're not looking at the gut as the root cause of how to get your patients better, you actually doing them a disservice. If they have dysbiotic bacteria, if they have a lot of yeast, that is making the environment very toxic and very inflammatory, which again, the immune system is not going to work optimally when you are inflamed and when things are not moving in the sense of supportive, right? It's moving in the sense of suppressing. So we don't want to suppress the immune system. So we have to get the gut 100%, at least 90% better so that the immune system can do what it's supposed to do.
Absolutely. And that's why I think it's important to focus on the gut health, whether you have cancer or not. And what's the best way to treat cancer? Prevention.
Correct.
And I don't want to say that in such a manner to be critical, but a lot of Americans don't really look at prevention, and this is something that we've really got to start teaching younger
Yes.
and taking action. Hey, Dr. Gez Agolli, Rethink My Health. We're going to be back in a moment after the break. Welcome back. Rethink My Health Radio Show and Podcast. What an exciting segment. Talking about the philosophy of naturopathic medicine, discussing different therapies, root cause, philosophy. And I love the fact that Dr. Volcy was talking about that she considers herself a teacher. As myself, I consider myself a teacher. Hey, if you are just tuning in to Rethink My Health, we want to thank you. If you're a loyal listener, we are grateful that you're here supporting us. And this show is about education. It's about empowerment, not here to replace your doctor's advice. We always ask you to seek help from a qualified healthcare practitioner. We're just here to pique your interest. We're here to hopefully galvanize you to take action. So it's been all over the media talking about cancers on the rise, turbo cancers, younger individuals. Shocking. I interviewed last segment Dr. Charles Meekin, board certified oncologist. He has never seen so many young Americans in their 30s getting cancer. He's been practicing for well over 35 years, and he told me when he started practicing, he never even saw anybody that young before. So it's shocking. And we're not here to debate why it's happening, although I do think it's important. I think we have a pretty good idea. It's multifactorial environmental. We talked about different pathways and some of the strategies. I want to stay here for a minute, Dr. Volcy, on toxicity. And we're getting into the root cause medicine in cancer. Toxicity, all-time high. But let's just back up a little bit. Give me your definition of a toxicant.
Oh, so many of them that we exposed to at the conference. One of the ones that stood out for me, of course, would be the herbicides and pesticides. And one of the things that they mention, it's not even the herbicides or the pesticide, is the solvents. The solvents that are actually added to those things are not even revealed to us. Benzene has been one of those particular toxins that has been linked. A lot of research studies have been linked to colon cancer, right? Especially in young adults. There are other toxicants that have been linked to breast cancer in women. So we also think about what we are taking in on a daily basis. The food that we are eating, our food is not clean. The environment is not clean. Lots of pesticides and herbicides. Those things are definitely causing the immune system, right? Again, we go back again to the immune system not to work optimally. Let's think about mold, right? So being in a moldy environment, if your home has mold, that's something you definitely want to check out because mold can cause a lot of suppress the immune system as well.
Absolutely. Mycotoxins. As a matter of fact, Dr. Burkett had a patient the other day and she was living in a moldy apartment. She was a CPA, and Dr. Paquette was sharing me the story with her, and she literally ended up in a wheelchair.
Wow.
And that's how serious it can be. And
Yeah.
she can't even think properly. And so he's got her on a protocol right now, hopefully, God willing, that she's going to turn around pretty quick. But sticking with the toxicity for a second, it's interesting. I asked you that for a reason, is that I agree with everything you just said. I mean, pesticides, herbicides, mold, everything. My definition of a toxicant is any substance that's an irritant to your body. Your body's a sponge, right? You're a sponge. We can't get away from toxicity.
Right.
Living on planet Earth, right? How do you get toxicity? Living on planet Earth.
Breathing.
How do you get heavy metals? Living on planet Earth,
Right.
right? We're a sponge. So, and I agree, those are terrible ones, right? But it could be anything. Somebody could be toxic to a smell of a perfume, right?
Oh,
Some of them have chemicals. Very, very simple rule of thumb that I personally have, and I tell colleagues and patients and friends and also students that I taught over my career, is that if you cannot pronounce the chemical on the ingredient, okay, you should not take it, all right? Just a rule of thumb, right? If I can't pronounce this chemical, don't take it, right? So let's talk about some strategies. Toxicity is here to stay. You can sit there and we can lobby to the government and do this, do that. And I understand sometimes we got to clean up the water, but we cannot rely on government officials or municipalities. They try to do the best they possibly can. You need strategies, right? Water filtration, air filtration, right? But let's talk about treatment philosophy. What were you recommending to help patients detoxify safely?
Okay. Well, I mean, first, I think the best is to test, because we don't want to guess, right? We don't want to just assume that they have particular toxins. So we have to make sure we're testing. Here at Progressive, the good thing is that we have lots of options. We have the hyperbaric chamber. We have the IV therapy. I think that is a very underutilized therapy that is, again, we're bypassing the gut, going straight into the bloodstream, so which patients can start feeling better right away. And you can start removing toxins out of the system. We have ozone therapy, again, another underutilized therapy where we are really filtering the blood, making sure that the patient is what we call with the ozone. If never done it, definitely you want to come here and get it done. A lot of patients actually feel better after doing the ozone. That's another way that we remove toxins. Think about sauna, sweating, right? So one of the things that we learn in naturopathic medicine, you have those 7 routes, or what we call the emunctuaries, right? Your detoxification pathways, are they open? Your skin is one of your largest organs. So if you're not sweating, you're not moving toxins out of the system. So you want to get into some type of infrared sauna just to allow the body to sweat and to heal. And of course, you want to make sure that, you are eating well, and you are, like you mentioned, is your water filtered, right? Are you drinking water that is going to support the system and not hurt the system?
That's great advice, because I'm a big believer in infrared saunas. As a matter of fact, I've been using infrared saunas for well over 25 years before they even became popular, and they're very, very popular now. And there's other strategies as well with the ozone. And we talk about cleaning out the blood. Blood is the river of life, and a lot of these toxins, it's very, very interesting how the human body operates from a protective mechanism.
Right.
It's just shocking, actually, but how the body even survives over these years. But literally, especially with heavy metals, in medical school, there's a textbook called Harrison's Textbook of Internal Medicine. Chapter 17 talks about toxicology, and that they've actually ascertained through studies that ingesting certain metals circulates in the bloodstream for about 30, 35 days, and it stores in the tissue. So this is not in your blood sometimes, right? It's in your tissue, which can be very, very damaging. Lead can stay in your tissues for or into your bones for 30 years. So a lot of functional integrative doctors and naturopathic physicians are doing a toxic body burden where they challenge the body with something called a chelator. And I do think that plays a role in looking with patients' root cause with integrative oncology. A lot of patients, when they get diagnosed, they go to a traditional oncologist and they immediately start on a protocol based on their cancer, sometimes not even testing. And that what a functional integrative naturopathic physician is going to do is test.
Yes.
What if you do have metals, right? What if you do have pathogens?
Mm-hmm.
So you need to know this stuff, because at the end of the day, you just should not be sitting there detoxifying, not knowing what you're doing. You can actually cause more harm.
Correct.
For not assessing that, because some individuals are slow detoxifiers,
Mm-hmm.
right?
Mm-hmm.
So that's really important. So would you say that from a naturopathic perspective, detoxification is fundamental and it's a foundation tenet for your philosophy?
Absolutely. Absolutely. I mean, we go back to identify and treat the cause. Same thing that we keep talking about. If you're not identifying what the burdens are, what's causing the patients to be in that state, we're not looking at the root cause of where it all started, it's really difficult to have a protocol that is going to target those particular areas or those burdens. So it's not like, okay, well, let's go ahead and treat this person not knowing what's going on. And one of the things that we do as naturopathic medicine is testing, and we have those functional labs that we do to find out what is going on with the person. Toxic metals, mycotoxins. We also do the stool analysis, of course, going back to the gut. We do lots of testing to, one, support the patient, but also to figure out what is the root cause so we can address the root cause.
Yeah, great advice. I totally agree with you on that one. And let's talk a little bit about some of the symptoms that we can educate our listeners on. What should they be looking for? For example, are there any symptoms that can actually tell if you are toxic? Give us some main symptoms that you can tell and can alert a patient to really take it to the next level.
Yeah, absolutely. I mean, I think every patient is going to be different. So no one patient is going to come in with the exact same symptoms. But if you are fatigued all the time, that's one thing that we see. The patient will come in, they are fatigued. They do not wake up refreshed. The second thing is that they have a lot of gut issues. We go back into the gut, a lot of bloating, a lot of gas, either diarrhea or constipation. That can be where the body is not processing the food because it's so toxic. When your cortisol is high, your body does not make enough hydrochloric acid to actually digest your food. So if you're having a lot of gut symptoms, you need to look to see if there are other environmental factors that could be causing you to be more stressed and decreasing your natural enzymes and hydrochloric acid. Other things is sleep, right? If you're not able to sleep well at night, that's pretty big. Some people have primary insomnia where they can't fall asleep, or secondary insomnia where they cannot stay asleep. You're sluggish all day. You have brain fog, inability to think. I get a lot of that. Patients will come in, oh my God, I cannot think. So we go back to the basics. So you're not looking at specifically pain, because sometimes it takes so long. It takes a while for the body for you to start experiencing the pain. But if you like fatigue all the time, that's one of the big signs that something is off and you should check it out.
And you're out of balance, and I totally agree with you. Those are great suggestions. So if you're experiencing that, especially that crushing fatigue, that malaise, lots of gut symptoms, interesting about the cortisol, primary insomnia, really it's the secondary insomnia, which has got a lot to do with the cortisol as well. That makes a lot of sense. Seek out proper testing and evaluation. Our philosophy at Rethink My Health is always looking at root cause, and do with what you can. I understand that there's always coming an expense with certain testing that may not be covered by your insurance. Your health is an investment. And I talked about this in the past, and it really depends what your goals are. One of the first things I always talk about when I'm teaching other practitioners is I always ask your patient, what are your goals? What are your health goals?
Yes.
Why are you here? So you have to define what your health goals are and how to accomplish it. There has to be a roadmap. And you did not get chronically ill, especially cancer. Now, when it comes to cancer, I just want to caveat here. You don't have time to think, right? You don't have time for the paralysis of analysis,
Correct.
Okay? You have to take action somewhere. Doing nothing, putting your head in the sand, this is not going away, okay? And if you decide to do allopathic medicine 100%, that's your decision. It's your body. It's your temple. I'm going to encourage you to at least do some lifestyle medicine. Dr. Pete Sulak talked about this. He had 2 aunts that had cancer. One actually only did traditional medicine, and she actually came out okay because she incorporated lifestyle. She included more walking. She stayed well hydrated, 6 to 10 glasses of water, filtered water. She was involved in prayer and meditation. So she had stress reduction. She had a whole support team, and she made some modifications to her diet. Her other aunt went all in on integrative functional medicine, and they both are cancer survivors. So, really what it boils down to is how resilient you are.
Correct.
And how you assess yourself. But there's no doubt the research is very clear, Dr. Volcy. You and I both know toxicity is definitely a major component of cancer. Okay, so let's move forward right now. I also want to talk about some nutritional strategies for integrative oncology. You and I have been doing this for a long time, but when it comes to cancer, okay, tell me some of the nutritional strategies, because everything is all out there.
Yes,
I mean, you've got somebody want to be keto and vegan, paleo, and once again, I want to hear your perspective.
Yeah,
you just got back from the conference.
And that's something that they did touch quite a bit at the conference. Again, this is where we do not put people in a box. This is where that is not a one size will fit all type of cancer. So when we think about, we talk about the blood cancers versus the solid tumors. If we think about, for instance, we think about brain cancer, right? So when it comes to brain cancer and nutrition, we do advise that or recommend that you go onto a ketogenic diet because of the fat in the higher fat in that diet and the success and the studies behind ketogenic diet and brain cancer. But when it comes to other cancers, you have to look at the complexity of cancers. Again, right? The pathways. So some cancers actually use fat for survival. Some cancers use glucose, direct sugar, right? So if someone has breast cancer, would I recommend the ketogenic diet? Not necessarily, because it can actually, that particular type of cancer can use fat as a source of fuel to cause the cancer to grow. So you have to know what type of cancer that you have and which pathway that cancer is utilizing. That's why, again, testing is important. So when it comes to cancer, the whole picture that you have to think about is whole foods, taking sugar out of the diet, and which cancer that you have and which pathways they are going to use, whether it's fat or glucose. But the key point is that you cannot continue to eat the way you used to eat. You cannot continue to eat foods that are highly processed, full of sugar, full of chemicals, because those things will suppress your immune system and fuel the cancer.
Great point. And that's why it's so individualized. And cleaning up your diet, whole food diet is the best, and we can really help you out. And that's why I encourage you. There's so much information and misinformation, right? So it's important to get tested. It's important to see if you have food sensitivities, because you can have a pristine diet and it could be 2 to 3 different foods causing inflammation. I've seen that before, actually. I've seen patients before have organic diet, eating broccoli and use broccoli and Brazil nuts, very healthy, but some patients have reaction to that. So even that. So I think it's important to do the testing on that. Okay, so I want to get into some of the other strategies. When you see a patient with cancer, all the testing is back. I want to get into the supplements for a minute, because I mentioned in the previous break. There's a lot of misinformation about supplements. And there's individuals that have cancer and their oncologist tells them not to take supplements, but intuitively, a lot of them know they should be taking it. So they just go out there, listen to this, read that, and before you know it, taking 20 pills. Okay. Let's talk about supplements. First of all, why are oncologists saying you should not be taking, let's just say vitamin C, for example? A lot of them say don't take vitamin C. Why is that?
Okay, well, there are a couple of reasons, right? One, lack of knowledge. And then 2, the fact that vitamin C, especially in the IV, if you do a low dose, is an antioxidant versus if you do a high dose of vitamin C, which is oxidative. So when we think about vitamin C, if you take an oral dose of vitamin C, your body needs that support. So I think, again, it's the lack of knowledge, not looking at every aspect of that vitamin C and how it can actually support the cancer instead of hindering the cancer. I think one of the things that they think about is that the minute you take vitamin C, it's not going to help the chemo, it's going to cause the cancer to grow more and not help with the chemotherapy.
And that's one of the reasons I totally agree with you on that. But high dose vitamin C is oxidative, okay? And once again, in fairness to the oncologist, they don't know. They're not educated on that. But there are some let's talk about some key supplements, okay, that we know support patients. What are some of the key supplements? Let's just say all the testing came back. What are some of your go-to supplements that you've seen and have been heavily researched for cancer? What are they?
Let's make that list. So berberine, right? Berberine is extremely important because, again, we want to target those pathways if the cancer is using sugar as that fuel. So berberine is extremely important. Curcumin is extremely anti-inflammatory, but it's a major antioxidant. So we have patients, even before we get all their testing back, those are some of the supplements that we do have them start on. Green tea is another anti-inflammatory. Green tea has a specific component that's called AGCG, which has been shown to help with not only supporting the immune system, but it's such a potent antioxidant. We have other things like we put every patient on this particular type of detox. So open up the lymphatic system, open up the kidneys and the liver to make sure that they are able to detox. Other ones, just basic ones. Again, we talk about the vitamin C. We talk about, as far genistein is another great supplement that we put our patients on. Resveratrol, quercetin, those are great. Again, we have digestive enzymes. So I have to go into digestive enzyme and systemic enzymes. So if the patient, based on the lab results, systemic enzymes are extremely important because the cancer will find different pathways and cause so much inflammation. So when you take systemic enzyme, let me explain a little bit. Systemic enzymes, when you take those away from food, they go directly into targeting inflammatory markers, versus digestive enzymes. When you take them with food, they help you digest your food. So it's important that you know exactly what you are taking to support the system.
Absolutely. I mean, that's great advice. I totally agree with you on that one. And I just want to also point out that Dr. Volcy is part of a team at Progressive Medical. They have an integrative oncology team. She's part of that team, working with medical doctors, nurse practitioners, and other naturopathic doctors as well. Health coach, a cancer health coach, actually, which I think is very important to coach you through this. Because you can learn all this information, but if you don't take action, if you don't have accountability, what good is it? It's like anybody else say, I know how to work out. Well, okay, but you're 50 pounds overweight and you're loss of muscle mass and toning. Why aren't you doing it? Well, I know how to do it, but you're not doing it. You need accountability. You need direction. You need encouragement. You need a whole team. When you're battling cancer, you need a team.
Yes.
And that's really the key. So I want to just mention that you and the whole team are very, very clear that measuring circulating tumor cells and looking for sensitivity, and that's why you like that particular RGCC Greek test, and then it can individualize the supplements, because once again, here's the goal. Obviously, the goal is to become cancer-free, but that takes a process. Now we're finding out integrative oncology, and all the research scientists out there are finding out you have to block certain pathways from these cancer cells from replicating. And so there's some really unique strategies. Dr. Volcy, we only have a couple minutes left, and I really appreciate your knowledge and your wisdom and coming on this segment of Rethink My Health. This is a very important topic, and this is a topic that we need to continue to research, and we need to continue to encourage our society to do a better job, right? To do a better job. And we declared war on cancer since the 70s, and now it's all-time high. So we have to do a better job. The take-home message from my perspective, listen, Dr. Volcy, naturopathic medicine plays a role. Naturopathic medicine is going to assist you through your journey. When it comes to integrative oncology, detoxification is one of the most pivotal foundations and changing your diet, because you change your diet, you change your life. Dr. Volcy, any other last strategies? We didn't even get into fasting yet, because I do believe there's fasting. We can talk about another podcasting segment on that. Any last words of advice for those patients out there that are battling cancer or interested in naturopathic medicine?
Yeah, absolutely. I mean, the number one thing is you need a team. You cannot do this alone, or you cannot just go with one strategy. Whereas the chemo may help for a little bit, but that's not the only way to go. You have to look at the integrative approach of how we as naturopathic physicians bridge the gap, and how we bring in what the body needs and how we support the body. Because when your immune system is not supported, that's when you don't do well with cancer. Why do some patients survive and some patients don't? As you mentioned, what are they actually doing? Are they changing the lifestyle? Are they decreasing stress, adding meditation? All of those things can help to bring in all the great results that we need.
Absolutely. It's a multifactorial process. Hey, this is Rethink My Health. Dr. Gez Agolli here, your host. I want to thank you guys for listening, turning in. Naturopathic medicine, check it out. Okay, it's been around for well over 100 plus years, and it's going to continue to grow and thrive. And we have forward thinkers out there helping our society get to the root cause. Stay tuned in a future podcast. We're going to talk more with Dr. Volcy and other team members of Progressive Medical. This show is sponsored by Progressive Medical. And we're just excited to bring you this information and this knowledge and helping you through this maze of information and sometimes misinformation. And remember, a cheerful heart is good medicine, but a crushed spirit dries the bone. God bless you guys. Be cheerful. See you next time.